Hi, you would have already known about microblading for thick and fuller eyebrows, but do you know that there is a similar procedure for your scalp? I am Dr. Aakash, Fellow in Dermatology at Cutis Institute, Bangalore, and today I'll be talking about scalp micropigmentation. Although the pigment is going to be implanted into your skin, the method of implantation for microblading and micropigmentation is different. In microblading, we'll be using needles to insert the pigment, whereas in micropigmentation, we'll be using a tattoo-like device to insert the pigment into your skin. This is done because more power is needed to inject the pigment into your scalp because the scalp is thicker as compared to the eyebrows. Scalp micropigmentation is a non-invasive treatment that uses detailed microneedles to deposit the pigment into the scalp. This creates the appearance of tiny hair follicles that help thicken and restore the look of normal hairs. Our recent refinement of the tattoo process for scalp application blends the technical component of a tattoo instrumentation and carefully selected pigments. When this is combined with the artistic and technical skill of your provider, it can address coverage of many scalp and hair cosmetic conditions. The requirement for each target area varies depending upon the numerous aesthetic factors, including the process of blemishes or scars on the scalp, skin color, hair color, the amount of hair that is present, and the color and viscosity of the pigment used. The SMP process begins by inserting a micro droplet of pigment through the skin and into the epidermis using a standard tattoo instrument, which supports between 1 to 6 needles, cycling at between 100 to 150 cycles per second. The needle must perforate the epidermis to get into the dermis. The stippling will vary in dot size based upon the artistic judgment needed once the process starts. If the pigment is placed only in the epidermis, the process will definitely fail because the pigment will leak out within a few days after the procedure is done. And if the pigment is placed too deep into the dermis, it will fail as it diffuses outside the confines or its origin of area of placement. The skilled practitioners at Cutis will work to ensure dots look like a natural hair follicle and blend in seamlessly with your complexion. The process of SMP will be useful for people who experience all forms of hair loss, which includes alopecia, thinning of the hairs, male and female pattern hair loss, cancers, post-surgical scars, and people who dislike using topical concealers and wigs. Before the procedure starts, your SMP practitioner at Cutis will apply a topical numbing agent for your scalp, and patient comfort is kept in mind during the procedure. Once you have done your research and sought out a responsible and skilled dermatologist, you'll likely have an initial consultation. During this time, we will discuss with you and prep you for what you are expecting and what you should prepare beforehand. For example, here are some general guidelines which we tell to a patient. Each treatment typically takes between 1 to 3 hours. How many treatment you'll need will depend upon the amount of area that has to be covered. Sometimes multiple sessions are also required. Treatment, if scheduled in multiple sessions, they would be scheduled a few weeks apart. After your procedure, avoid exposing your scalp to the sun for the first few days. Wearing a hat is also fine. Keep in mind, though, less the sun exposure to the treated area means better long-term retention of the pigment after procedure. After the final treatment, it is essential to avoid sun exposure for 28 days and thereafter use 30 to 50 SPF sunscreen. Avoid heavy exercise for the first 5 days after your treatment. Begin to regularly moisturize the treated area after 4th day of your treatment. The price of SMP varies depending upon how much of your scalp needs to be covered. Micropigmentation is considered semi-permanent. While the effects may last up to years, the treated area will fade over after a point of time, since the naturally occurring skin exfoliates itself, while the color may lighten over a period of time. That said, if you have a very dry skin, fading is likely to happen more quickly as the skin tends to flake with the dry skin. This can hamper and exfoliate the pigment at a quicker rate. If you have any other skin related problem, you can leave a comment below and we'll get back to you. Or else you can also contact us on our helpline number. Thank you.